All right, welcome in the actual Twitter doctor, Brian Sutterer. Great YouTube channel, Brian Sutterer MD, already has a video up about Luka Doncic. We're going to talk all about Luka Doncic and his calf strain. Brian, let's start here. How vague is the term calf strain?
It's vague. It's really hard, especially from what I try to do with providing education about these types of things. It's very vague. When we talk about the calf, it's actually a complex of three different muscles. And so question number one is which of those three muscles are involved? And then question number two is where in that muscle is the actual strain or the actual tear? Because whether or not that tear is higher up in the true just kind of meet the belly of the muscle, or if it's down closer to where those calf muscles turn into the Achilles tendon, it's very different in terms of the actual prognosis. And so calf strain really just tells us it's somewhere in the muscles on the back of his lower leg. And beyond that, we unfortunately just don't have any more information.
it's like operation. It's like it's in that general area. We just really have no idea what it could be.
Exactly.
Or how does a player feel when you have a calf strain? Like, can a player feel how serious it is? Because when you saw Luka, like lean down and start rubbing on that muscle, like you could tell it was a little different than normal. Do you think that players can feel how serious an injury is like that?
They definitely can. And one of the ways we'll actually classify severity, we hear about grade 1, grade 2, grade 3 with all these different injuries through the body. One of the ways you can classify severity of these muscle strains is whether or not there's actually impaired function, like impaired strength, whenever the athlete's trying to activate that muscle. So the calf muscles in the back of the leg, the primary function is for you to raise or lift up on your toes. So if you're standing flat on the ground and you just lift your heels to push up, like you're doing a calf raise, in the gym, you're activating those muscles. And so when you're walking, definitely when you're running, if you activate those muscles and you have pain, that can suggest a more significant injury. Sometimes people will feel like an actual tearing sensation in the back of the leg. Like with Achilles, of course, we see people always look back like somebody, hit them with a baseball bat in the back of the leg. So it's not that extreme, but definitely based on how much pain and how much limited function the athlete has, the medical staff can get another kind of sense of severity for sure.
So he'll feel something different, right? Because it did seem like Luka. We've seen Luka have so many injuries where he just pops up, like punches his leg a couple times and he just feels better, right? But
tighten the shoes tighter.
Yeah, right. That's when players feel like the pop or they feel something like that. Is there anything like that in a calf that Luka could feel, or is it just he feels
they'll typically feel kind of a sharp pain. Usually athletes will describe it. We ask, is it burning? Is it throbbing? Is it dull? Typically a muscle strain is going to be sharp. So especially whenever you activate or try to fire that muscle, it's usually more of a sharp type of kind of localized pain where the area of the injury is. The challenge can be then as you kind of immobilize things, go through your rehab, you might get more kind of diffuse pain. But definitely initially, we kind of saw after, the commentator seemed to focus on, he bumped knees. Was there like a collision there? But it was really, as you saw, when he kind of made that turn to then push off and go back out towards the 3-point line, that motion is where he would have felt that really sharp pain. And then as he continues to walk, he continues to feel that sharp pain and is clearly impaired. And so that tells him that, hey, this is not just some other little tweak or bump that I can typically bounce back from.
We were waiting to hear any kind of news. I mean, it feels like the entire Mavs fan base just has, holding their breath all day. We finally saw a photo of him walking around in a boot. What does a boot tell you? So he's walking around in, a boot where you normally see somebody like, broke their foot or something like that and they're on crutches. But what does a boot tell you and what does it not tell you?
Well, the purpose of the boot right now is to just immobilize things. So whenever we talk about recovery from a muscle injury, it all comes down to the basic kind of biology of what's happening inside the muscle when you actually have that tear. And what we're trying to do with the recovery is sort of augment and take advantage of the body's natural progression with healing. And so that first initial phase, those first couple of days, it's a tough balance between strictly immobilizing someone so that you don't put any more tension, any more tightening on that muscle to make the tear worse, but also not immobilizing them so long that the rest of their muscles atrophy. So when we see him in that boot, a boot can be worn to stabilize the ankle ligaments, but it can also be worn to prevent your foot from bending up and down. So in Luka's case, it's simply to prevent him from activating those calf muscles and pushing up on his toes. It's early enough that it doesn't really tell us much prognostically. Certainly if we saw him walking around without it, that would be great because that would suggest he's not having a lot of pain with just basic walking around. But the fact that he's in it, it's so recent, it unfortunately doesn't really give us much of a negative prognosis down the road.
And I saw you talking with In Street Clothes on Twitter about this. There's some gamesmanship in some of this too, right? Like if he's walking around without a boot, all of a sudden that could tell everybody, hey, he's totally fine. He's going to be good. But you put the boot on and I don't know, it makes the other team maybe think that, hey, this guy could be out for a couple games here.
Right. There's definitely an aspect to that. And, as much as I would like to see more information so that we can talk about it, teach about it, and Mavs fans want to see more information here, the teams that they're going to be going up against, they know that data also. They have access to those same papers, those same studies, that same set of experience to where if they hear in the report, ooh, it's a grade 2, oh, that maybe might be this length of recovery, so maybe we can kind of adjust our game plan accordingly. Which I think is fine. As much as we would like to know more information, we know it's a calf strain. We know it's not a big Achilles injury. We know he's presumably not out for the playoffs. But you're right. There's definitely a piece of this that they probably don't want to tip their full hand to know what he might look like 2-3 weeks down the road.
So if you see him in crutches and a full body cast, then, maybe they're taking it too far.
Right. So that might go the other way. If he's being pushed in a wheelchair into get the MRI scanner, then there might be a little bit more questioning.
What are those phrases you're waiting for, right? I've heard like grade 1, grade 2. What are those certain phrases you're waiting to hear to know how serious this is?
Hearing grade 1, grade 2, grade 3 would definitely make a difference. To be honest, it's more so I think about the location in the muscle in terms of where that tear is. Because remember, a strain is actually a tear of those muscle fibers. Our muscles have these individual fibers running through them. And whenever you get a strain, a contusion, those fibers, those cells tear and they die. And our body has to go through that process of healing. The closer that tear is to where those muscle fibers join into the tendon, the more prolonged the recovery is going to be. And so it's more so, if we hear grade 3, I mean, that's the type of scenario where I can't imagine he would be back unless they made it to the finals. If we hear grade 1, grade 2, there's enough overlap there that really we could be anywhere on the order of like a couple of weeks to 3 weeks. But I think what's more important is if we were to hear about the location. Typically, we don't hear about the location because that's just more detail than these teams provide. But I think the bigger telling sign is going to be watching his actual functional recovery if we see footage of him on the court during these next few days, because these next few days I think are going to be critical to help us understand how bad is this? Is this something that he needs prolonged immobilization? Is this something that come, Thursday, Friday, we see him jogging around on the court? I think those are going to be the bigger telling signs of what his availability will be upcoming here.
What kind of recovery can they do? Can Casey Smith and Luka and the whole team do over these next 5 days? They have 5 days off. What kind of things can he do besides just like, elevation and put ice on it? You know what I mean? Like the
rice
normal
therapy.
things we do.
Yeah. The good old rice therapy. So, and honestly, it goes back to those fundamentals of biologically speaking, what's happening in the muscle with the tear. The first thing that happens when you get that tear is there's blood that forms. There's a hematoma. There's kind of this area of swelling. And as much as you can do initially to minimize how much bleeding is in the muscle, how much of a hematoma is there, the better you set yourself up down the road. So sometimes if there's a significant collection of blood, they might actually go in with a needle and aspirate or drain that blood out to help facilitate the early healing. When you get past that initial immobilization phase, now you have to actually start to work the muscle and start to stimulate those muscle fibers to regrow because they actually respond to movement. And so it's having that experience, which thankfully the Mavs training staff has, of knowing what that balance is, of listening to how much pain he's in, knowing how much they can push the muscle to ultimately progress him. But there's no magic pill. Some of these teams are doing things like platelet-rich plasma, these stem cell quote unquote injections, and there's some data to suggest that might help facilitate healing. But this isn't like an infection where you can just get antibiotics and then in 7 to 10 days you're off and you're clear of the infection.
So Luka's going to go over to Germany and get one of those injections and
the Kobe Bryant shot. I honestly don't know. It's something I always wonder is how much these different teams are doing it, because obviously it's very different than if you and I just like go into our doctor's office because we strained our calf playing like, beer league softball one day. And so there's some things they can certainly do, as basic as it sounds, the ice, the cryotherapy is again trying to help reduce the amount of blood, reduce that hematoma that forms, so that you can allow the body to kind of kickstart that healing process sooner rather than later. Because here, when we're talking about days, it really does matter, right? I mean, this isn't something where we can spare a week or two. Every day does matter. And so it really is going to be all hands on deck for them to minimize that swelling, get his motion back as quickly as they can, and then help to kind of progress him back through his functional return.
God, how annoyed must Luka be right now with everybody just looking, prodding, touching, and
horribly
asking about his calf right now. Last question, the one that Mavs fans don't want to hear at all, but I'm very interested. What are your thoughts on the players we've heard before, like Kevin Durant, that started with a calf strain and then he came back and went into the playoffs? And Luka's a lot like Kevin Durant. If he can play, he's going to play, and he's going to try to play at his best. And that calf strain turned into Achilles tear. What has to happen for that to happen, and how can Luka avoid something like that?
Boy, yeah, that's the $1 million question, right? I still think, and I don't think we'll ever fully know what happened with Kevin Durant. My gut and everything I know about medicine tells me that the two were not related, that his calf strain had nothing to do with the Achilles strain, unless they were just not accurately describing what his initial injury was. And so, having seen enough of these on imaging, on ultrasound, typically they're in far enough away proximity to where it's not like, a millimeter from the Achilles tendon. If it's way up in the muscle, the tendon is so far down out of the way that sometimes unfortunate bad things just happen. And so I wouldn't be worried about that scenario. It's who knows, right? In the world of medicine, crazy things can happen. Whenever that injury actually starts to heal with the strain, initially in kind of that first 10 days or so, the actual tear site where you're kind of building up some scar tissue is the weaker site. But then once you kind of get beyond that 7 to 10 day mark, it's actually sort of the surrounding tissue that does become weaker. So theoretically, sure, depending on the location, maybe you make the area where the Achilles and the calf muscle come together a weaker spot, but you still would have to subject yourself to a load that would be high enough to tear an Achilles tendon, which is super rare in a young athlete. So as fresh as that is, I would not be worried about that going back out there, assuming this is your run-of-the-mill, gastroc strain that we see all the time in sports.
And it's not something where he would overcompensate. We hear a lot about how, you overcompensate on one leg and then the other leg comes out. You can't do that in a muscle where you overcompensate using maybe your Achilles more than you would use your calf when you're pushing off or something like that.
On the same side, not necessarily, because the calf and the Achilles is all sort of the same muscle tendon unit. Whenever it fires, everything is being stressed kind of along that whole pathway. Certainly side-to-side differences or kind of above the joint, below the joint. So if, let's say, Luka comes back and his calf is a little bit weaker, maybe his range of motion is a little bit reduced, then certainly you do set yourself up for injuries because of that asymmetry from side to side. Or now maybe he's loading his hamstring a little bit more, and so the hamstring is more susceptible. But in terms of that kind of continuous Achilles calf unit, it's not something that we typically think of and counsel patients on whenever we return them to play from their calf strain.
There you go. Great stuff as always, Bryant Sutterer. Go check out his YouTube channel. If you're not somehow already subscribed to it, go check it out. Good stuff. Thanks, Brian.
I appreciate it, Nick.